wonderful nursing friends. So today we're going to learn how to use our stethoscope to auscultate our heart sounds, lung sounds, and bowel sounds. So as you can see, I have this awesome t-shirt right here. Woo! I'm going to rock this in summer. And what I did was I just marked my landmarks for auscultating the heart, the lungs, and the bowel sounds. And if you have an old t-shirt at home or, just a new white one that you have that you can mark on, grab that so we can go through all these things together and get your stethoscope, and let's get started. So for the heart, we have 5 landmarks to cover: aortic, pulmonic, herbs, tricuspid, and mitral. Easy way to remember that is all pigs eat too much, all right? So how are we gonna find this? Because obviously I marked this all over my t-shirt, which is the black ones, these ones that are in circles. And an easy way that I found my landmarks is to find your clavicles first, and which I drew those lines up here. I hope they are matched up with my clavicles. But an easy way to do that is to push out your clavicles like this. I hope you can see it, because I can feel it. And you're going to take your first finger right under there, and that is your first intercostal space. And then you're going to palpate and try to find your second, which I think, perfect. That's my second. Let's see if it matched up. Not quite. Okay, I'll just move it down. But after you find your aortic and pulmonic landmarks, just by doing that, you're going to be able to find the rest, because the rest are all on the left side. To the left, to the left. Okay, so we have our aortic, which is on the right sternal border, second intercostal space. And then we have pulmonic, left sternal border, second intercostal space. Going down to the third is herbs, fourth is tricuspid, and then mitral is mid-clavicular line. Oh, such a long word. Mid-clavicular line, fifth intercostal space. So with heart sounds, we are looking for 2 things: rate and rhythm. Now, let's talk about rate first. 60 to 100 beats per minute in adults, and it varies upon age for kids. And a good way to take someone's heart rate is radial pulse. That's the easiest. And the carotid pulse as well. And that's really important for emergent situations. So how do you take someone's heart rate? Real quick review. What I do is take it for 10 seconds, count how many heartbeats I hear, and then multiply it by 6. Now, using your stethoscope to assess someone's heart rate is really important. And I'm going to ask you guys why in a minute. So I'm going to take the diaphragm of my stethoscope, and I'm going to place that over the mitral landmark, which we covered. Mid-clavicular line, fifth intercostal space, and that's also known as the apical pulse. So I'm going to ask you guys to comment down below what medications require you to take a patient's apical pulse. And I'll give you a clue for one of them. It starts with a D, and you're probably like, oh, I know this one. So yeah, that's very important. So I'm going to ask you guys, why would we take someone's apical pulse? Why? And what nursing interventions would we take if we have to hold that specific medication if someone's, let's say, heart rate is below 60 beats per minute? What would we do? What's a nursing intervention to get their blood pressure back up? Maybe I kind of gave it away, but comment down below, okay? So now let's talk about rhythm in relation to our S1 and S2 heart sounds. So you're going to take the diaphragm of your stethoscope. Easy way to hold it is like this, and place it over your aortic, pulmonic, herbs, tricuspid, mitral. Do that all over again. And what you should find is that on your mitral and tricuspid landmarks, you're going to hear the S1 heart sound louder. And aortic and pulmonic, you're going to hear the S2 sound louder. And same with herbs, you're going to hear S2 louder. But why? When we look at the anatomy of our heart, we have our mitral and tricuspid valves. And when they close shut, that's what makes the first heart sound. Pretty cool, right? And aortic and pulmonic valves, when they close shut, that's what makes the second heart sound. So with our S1 and S2 heart sound, we have to make sure that it's a regular, consistent beat, right? This is it. It reminds me of Hitch. Have you guys seen that movie when Will Smith is like, this is all you. This is all you. This is your spot, right? We don't want a DJ coming in there and be like, woo, you know, doing all these crazy stuff. But what if there is a DJ in your heart? What if there is a DJ in your heart? Ask your patient that. So you're going to take the bell of your stethoscope and you're going to go through all the landmarks all over again. And what is the function of the bell? It's supposed to detect low pitch sounds, right? So what are low pitch sounds? Extra hard sounds such as your S3, S4, and murmurs. And going through all that with the bell of your stethoscope, you're going to be able to listen to that. So that is it for heart sounds. Now let's move on to the lungs. So with the lungs, we have 3 landmarks: bronchial, bronchovesicular, and vesicular. So let's go over them. And I have that in green. And an easy way to find your bronchial landmark is where your clavicles meet. And I already drew them on my shirt. So it's usually right around there, and it's by that tracheal tug that you have. It's like a little fossa. When you go in, it's like a little indentation. So that is bronchial. And then we have bronchovesicular, which is right and left mid-clavicular line, second intercostal space, which I have right there. And then we have vesicular, which is over your entire surface area of your thoracic cavity. So it's anterior, posterior, and lateral. An easy way to find your vesicular sounds on the back is to find the scapulae. Go like this, and find the scapulae, and go right in between with the diaphragm of your stethoscope, like that, and go down. And don't take your stethoscope off the patient. Glide it on there so that it's easier to compare your left and right lungs. It's really important. So what are we listening for when we are auscultating our lung sounds? We are looking for, crackles, wheezes, bronchi, pleural friction rub, all these abnormal lung sounds. It's really important to try to detect that. Now, when you go into your lab skills, you're just gonna hear clear and equal, and it's like, you can't hear anything. But when I went into peds, that's when I really heard, crazy stuff. I heard wheezes, I heard grunting, I heard a lot of things, especially in the ER. So that's where I got a lot of practice listening to those types of sounds. And for me, I don't think you guys know this, but I do have asthma, and I do have my inhaler. I take albuterol. And when I was a kid, it was really bad, like really bad. My mom was like saying I had wheezes, and even when when the wind would hit my face, I would I couldn't even breathe. It was really bad. But now it's controlled, it's okay. And it's called allergy-induced asthma, when there's dust, pollen, and when the seasons change, it gets really weird. But I'm glad I have that under control, so I'm okay. But it's really important to auscultate those lung sounds and figure out your landmarks and everything like that. And what you do is, again, take the diaphragm of your stethoscope and go through those sounds. So that's for the lungs. Now let's look at bowel sounds. We saved the best for last. Yeah. So as you can see on my shirt, on my abdomen, I drew 4 corners or 4 quadrants. And this pink line right here just shows the ascending, transverse, and descending intestines, just to follow that, your anatomy. It's really important. So that's kind of what I imagine whenever I'm going through all those quadrants for 15 to 20 seconds. I know the book says 1 to 3 minutes, but ain't nobody got time for that, all right? So what are we listening for? 3 things: hyperactive, hypoactive, and absent bowel sounds. So hyperactive, the way that I look at that is it's frequent sounds. It's almost like after you ate a big burger with, your fries and your Diet Coke or whatever, and your intestines are working. They're gurgling. It's just frequent sounds. And hypoactive, that is best heard when you just woke up. You haven't had anything to eat in 8 hours, right? Nothing's really going on in there. So those are hyper and hypoactive bowel sounds. Now, when we look at absent bowel sounds, you are not hearing anything, not even a little peep. And that is really important to auscultate. If you're not hearing anything in 15 to 20 seconds, stay on there for 1 to 3 minutes. Nothing, stay on there for 5 minutes. And in 5 minutes, if you didn't hear even 1 peep, it's really important, call a doctor, because it could be something as simple as constipation, to something really serious as paralytic ileus if they're a post-op patient, or it could mean, intestinal obstruction. It could be something. So that is what's considered an absent bowel sound. If you stay on there for 5 minutes and you don't hear anything. So the way I do it is I take the diaphragm of my stethoscope and I go through all 4 quadrants. So I start in the right lower quadrant and I go up, go to the side, and go down, and I do it one more time. So you are technically following the anatomy of your intestines. You're ascending, transverse, and descending, all right? So that's for bowel sounds. So I hope this video was really helpful and was a review for some people, because I know a lot of you are in your 2nd year or maybe in your 1st. And those of you who are going into nursing school, I hope this helped you guys out too. And if you have any questions at all, just please Facebook message me. All right? Talk to you guys later. Bye. I'll be seeing you maybe by